My name is Kristen. I just gave birth to my daughter Stella 2 weeks ago.
My name is Lisa, and my daughter Karen was born 5 months ago.
My name is Genna Campbell, and my son Liam is 8 months old.
The third trimester, I would say a little bit of that fatigue starts to come back, and it's mainly, I think, because you're a little uncomfortable. Exercise isn't as easy. That spinning class isn't a breeze.
Till about the end, I think 36, 37 weeks, I was feeling great, comfortable. And then once the baby kind of dropped, I became a little bit more discomfort. And with like the sciatic pain, maybe shooting down your back or your through your chest or something randomly, but it wasn't like constant. So getting up and moving around, that helped. Eating smaller meals, things like that. A little bit more in the napping. I definitely had to do some of that. But really, up until I delivered, I was pretty darn comfortable.
Third, of course, you're starting to get antsy. You want that baby to be here, but there's the nerves that you're looking at because as a first-time mom, you've never been through labor. You have no idea what to expect.
My name is Michelle, and I'm a labor and delivery nurse manager. Most important things are to know what signs to look for that you may be having trouble in your pregnancy. Contractions that happen, those are things that you would want to call about. So contractions, if you start to have excessive swelling, if you start to have headaches, those can all be signs that you may be having trouble in your pregnancy. So the contractions, you want to make sure not to disregard those, to get some medical advice about how to handle those. I think the really important thing is that unless if there's a medical indication, we don't want women to deliver before they're 39 weeks pregnant. So sometimes we get very anxious and we want to rush those things, but really babies need to be 39 weeks, unless if there's a medical reason not to.
My due date came and my due date went, and baby Liam was still not here, and somehow I never thought about the fact that he could be late. And so, a week went by and baby Liam was still not here, and almost 2 weeks went by and baby Liam was still not here. And it's like, okay. And then I went in, when you start getting that far off your due date, they have you come in and hook you up to a fetal monitor just to make sure baby's okay.
Women have many different signs that labor has started. Some feel a low, dull backache. Some feel actually pains coming down their legs. Some feel like they just have a little bit of gas. And so sometimes it is hard to tell at first if labor is starting. But the true sign of labor is that your contractions that you're having get a little bit longer, stronger, and closer together.
Hi.
I think every new mom experiences being overwhelmed. The first one, I would say it's the overwhelming fear of, am I doing this right? If the baby's crying, is there something I should be doing that I'm not aware of? The second one, it's more of a overwhelm, like, okay, how do I balance this with two now and, keep everyone happy, including myself.
Postpartum, it's hard. You go home and you think, oh, I'm not going to be, kind of the baby blues they talk about. You think, I'll be okay. And then you get home and something overwhelms you and you just cry. And it's nothing big, but you do have a lot of hormones and emotions going on. You have this brand new baby that you're bringing home and you're like, are you sure that I'm okay to bring this baby home? Because it's a little human and you're totally responsible. So it's very overwhelming.
He would eat every 15 minutes and just cry nonstop. So the first 2 weeks, I don't think I slept for more than 30 minutes at a time. And I didn't sleep for more than 30 minutes at a time. And even then it was kind of just, I don't really remember the first 2 weeks. He was just crying the whole time. And then it's like he hit a turned a corner and he started sleeping 3 hours at a time and then 4 hours at a time and 5 hours at a time. So it just steadily got better. Postpartum depression isn't something that's, here and there. A lot of women go through postpartum depression. I think having that support group around you, your provider, your nurses, and your family members really can help to combat some of that.
I still do, and my daughter's 5 months old. I needed lactation consultants because my son they call it being tongue-tied. His freedom is short under his tongue, so he had a hard time nursing. And through different tricks and things, tools from some of the lactation product companies, I was able to continue nursing him successfully, even with that. And with both children, I'm not one that is a high producer in terms of milk. So working with a lactation consultant definitely helps you understand how to better control your nutrition and take, supplements if needed and do things to increase your milk production and keep it up when you go back to work.
I would call lactation almost every day, the lactation consultants, and they would answer my questions and reassure me. My mom, my mother-in-law, friends that have breastfed and had little babies. I mean, everything I came across, every person was reassuring. So I knew I was doing it right. Stay active. I mean, I know it's hard. It's really hard, but you got to push yourself. I mean, I wasn't doing anything crazy. Even walking towards the end was something that was helping me, kind of get my heart rate going and help me for the labor process.
I belong to a mom's group that occasionally gets together to do fun things with the kids. And in groups like that, there's a natural support mechanism where you automatically share, hey, I'm having trouble with this, or I'm looking for this, and, just sharing ideas and things to make motherhood a little easier.
I had a lot of support, and definitely if you're thinking about having a baby, think about what kind of support you want after that baby's born, because if you have it lined up ahead of time, you can survive.